I'm Dr. Kurt Schreiber at CMH Neurology and Headache Center. We're pleased that you're going to be coming to our center or our program. We're looking forward to it. We're getting ready, and I'd like to ask a favor of you to please get our paperwork filled out to get ready on your end as well. That'll really help us get honed down to your case and your care, and we can all do a better job. As we go through this, I'd like to give you some tips of what we're thinking and how to think about the answers as we go through the questionnaire. So I'd like to take a few minutes to walk through our questionnaire this morning. The first question is, when did headaches first occur in your life? And really what we're trying to get to is a history of your overall headache pattern. Did it start recently? Did it start a month ago, a year ago, 10 years ago? Did it start a long time ago and come back? So we'd like you to reflect on your life with headaches and when headaches really first appeared in your life. Question number 2 is, how often do you have headaches? And we're trying to get a ballpark idea of how that is. I know these are sometimes difficult to pin down, but what I'd like to try to get to is it a headache that occurs frequently, infrequently, and if we could gauge it by how often a week or how often a month, that would give us a good idea of the pattern of your headache. Question 3 is a really important one, and it doesn't have to do with headache, it has to do with how often do we have days where you can say no headache at all. And that could be infrequent, it could be frequent, but we're looking for a general ballpark idea of how often you can really say you had a whole day without any type of headache. Question 4 is about triggers or things that might start headaches. Some people can recognize that there are triggers. Sometimes they notice certain activities, certain exposures, certain things that go on in their life. It might be a factor that brings a headache on. Sometimes it's not clear. Sometimes it's just random. Not everyone has clearly defined triggers, but some people do. And this question is really to ask you to reflect to see if there's a pattern, if there's something that you're noticing as a consistent factor that tends to bring on or cause your headaches. Question 5 is there a particular time of day that headaches tend to occur? Some people notice this. Some people would say always in the morning, some typically in the afternoon. Some say really can't say there's a pattern. So I'd like you to reflect on your headache pattern and see if you notice anything that's going with the clock. Do you wake up with it morning, afternoon, evening, or is it just random? Question 6 is asking about other symptoms that you might notice before a headache starts. And really we're asking you to think about a day that might start without a headache and a headache comes sometime during the day. And I'm wondering, is there anything that you notice ahead of time? Any way that you feel, any other changes that you can tell that would be predictors? Something else in your body before a head pain that might occur. Some people might notice those kind of changes, some people might not. But if you notice those changes, this would be a good place for us to record it and write it down. Question 7 asks about visual changes. And really the visual changes that we're looking for are things that show up in your vision, such as lines, sparkles, shimmers, zigzags, spots in the vision. Those would be really important to note if they occur before, during, or after your headache. Some people might notice visual blurring. That's worth writing down, but we really want to be sure we don't miss those visual phenomena like lines, sparkles, shimmers, other things that show up in your vision. If you have those, let's hear about it. If you don't, you can say don't have those. Question 8 is looking at location. Where is the headache located at the beginning and where does it wind up? Some people notice it's always in the same place. Others might say it's random. It can be various places. If you have it in the same place every time, we should get that recorded. If you have a part of your head that's most commonly involved, that would be good to know. If it's random, well, it's random. That's how you would record your answer there. Question 9 asks about the time it takes for a headache to build in. And this is really asking about your most frequently occurring headache. How long does it take from when you first feel the pain part of headache until it goes up until its strongest intensity? And that could be variable. Some people might say it's seconds, some might think minutes, some it could be hours, some people say it builds up all day. And there could be variability for each individual. Some people may have some that hit quicker and slower. This question is really focusing on the most frequently occurring headache to get a gauge for how long is the build-in time. Question 10 asks, what does it feel like? And what we're trying to get to here is what's the quality of the pain? Not necessarily the intensity, but the quality. And that would mean things like, is it sharp, dull? Is it squeezing, pressing, throbbing, pulsating, burning, zapping, zinging? Those are the kind of descriptors that we're asking you to think about. Sometimes it's hard to find that right word to describe what headache feels like, but I'd ask you to do your best to think that through and record it here. So question 11 focuses on intensity. And what we really are asking you to do is to tell us the intensity of your most frequently occurring, the most commonly occurring headache. We like people to use that 0 to 10 rating scale. It's always hard to use that. As far as I know, pain doesn't come with a number on it. But what we'd like you to do is think about a 0 to 10 scale. 0 is supposed to mean like none. And 10, that's supposed to be your highest pain ever experienced. So we'd like you to use that kind of a rating scale for your own individual assessment of pain, from 0, no pain, to 10, the most intense you've ever experienced. And on this question, we really want you to tell us what's it like most of the time. Yet we know there might be some headaches that go higher. We want to know about that too, but we really want to know the most frequent intensity that you experience with your headaches. So question 13 is really looking for information about duration or length. How long does it really last? And what I'd like you to think about is your most frequently occurring headache, most commonly, from the time you first feel the pain until you can say it's really completely washed out of your system. How long is it? I know there might be some times when the headache goes on longer, and we want to know about that. But for this question, we want to focus on what's it like most of the time? How long does it usually last from pain onset to complete resolution? So question 15 is really to ask you about other symptoms that may come with your headache. You may have these and you may not. But if you do, this is a great way for you to think it through and check the box to tell us if these things occur with your headache. And you can see the boxes. We're thinking about light sensitivity, sound sensitivity, nausea, several other symptoms that might be associated with your headache attack. If you have those, please let us know. If you don't need to check those boxes. Moving on to question 16. That's really the question about your family history. And by this, of course, we're talking about blood relatives. And a good way to think about that is to think about your ancestors, meaning like your folks, your mom and your dad. Did they have headaches of any kind? Thinking about your siblings, your brothers, your sisters. Do they have headaches? Did they experience headache at any point? And another part of family history too is to think about your kids. If you have kids, did they develop headaches? And we'd like to know about your family history of headaches in that sense, from parents, siblings, children, who in your family has headaches. And if there's nobody, that's great. You can leave that box blank or put 0, but think through your family history for us to let us know about that. So moving on to the question about how do you treat your headaches currently? And we want to know what your approach is. If you do things that don't involve medications as part of your treatment plan, this would be a good place to record that. If you do take any over-the-counter medicines to treat a headache attack, we want to know about that too. If you have prescription medicines that you currently use to treat your headaches, we want to know about that. If you wind up needing to go to your doctor's office or to the emergency room for treatment, we would want to hear about that here too. So this question is really focusing on what are you doing right now? What's your plan for your headache when it strikes? So if you could record that, that would give us a leg up on knowing if the treatment plan's working or if it needs to be changed. Question number 20 switches gears on your current treatment. And what we want to think about here, are there any medicines that you take on a daily basis with the goal of not treating headache that day, but of preventing headaches from breaking through? If you do have a treatment plan that includes daily treatment with medications, or if there's any other form of preventive treatment, such as injections or other things that are being used on a regular basis with the goal of preventing headache, we'd like you to record it here. The next set of questions really focuses on lifestyle factors. Lifestyle factors can be important for a lot of people with headache. And really what we want to know about is how much caffeine you use on a regular basis. That can include soda, tea, iced tea, coffee, energy drinks, any other form of caffeine. We'd want to know about it here. We want to know if you're a good water drinker. So you need to kind of get a gauge on, do you drink water? How much a day? Give us a reasonable estimate of what your daily intake of water is. Do you eat 3 meals each day, or do you tend to skip? For a lot of our patients, that's important. If you tend to skip meals, we'd like to know which one or ones you tend to skip and how often. Another important factor can be exercise. If you have an exercise program that you do regularly, we'd like to know what it is. If you don't have one, we might talk to you about that when you're here. Question 26 asks you if you've ever had a brain scan. That would be an MRI scan or a CT scan of the brain. If that's been done previously, we might be able to get the reports or the pictures, hopefully. So if you could help us by telling us when and where that might have been done, it would be good to have that information for us so that we could get a hold of those images to see if we need to recheck or do anything else with brain imaging. On question 27, we're asking if you've ever been to a neurologist or headaches person or had a treatment plan previously. It might be good for us to get records on that to see exactly what medications or what doses had been prescribed. And so if you can help us by finding those names and those locations, that would give us a chance to possibly get those records to double check some of the details of the previous treatment. So in question 28 and 29, this looks like a lot of work, but it really isn't. But what we want you to do is carefully read through these lists to see if there's medicines that you have taken previously. So we've listed them by brand name with generic name in parentheses. And if you could really take a good look through that to see if there have been previously prescribed medications. And if you did have a response, either good or bad, it would be nice if you could give us some extra information as to whether it was a good choice or a not so good choice for you. And that'll give us a good chance to review what options are out there. There's a lot of options. We want to make sure that we're picking the best option for each individual person. Thank you for going through this form. I know it looks like a lot of work when you first start it, but I think when you get to the end, it won't be as bad as it looked at the beginning. It will really help us help you by getting that information collected ahead of time. And it's a good starting place. It's a good starting place for our conversation when we get together to make sure that we're filling in any extra details and working together to fine tune, to craft a plan that hopefully will be more effective for getting you where you need to be with your headache treatment.